And now I'd like to introduce our speaker, Sophia Paranto with Optimus Insurance and Benefits.
Thank you so much, Megan, and good morning, team of members. Thank you for taking some time out of your day today to sit and talk to me about telemedicine for yourself, your employees, and your business. So I'll give you a little introduction about me. My name is Sophia Paranto. I am an employee benefit advisor at Optimus Insurance and Benefits. We've been serving the Nevada business community since 2001. And I started with Optimus. I started working with them in 2010, right after the Affordable Care Act was passed. So that's really all I've known. I'm in the small to mid-sized business space. I'm passionate about what I do. I love helping employers save money, offer comprehensive benefits so they can attract and retain great employees. And when I'm not helping my clients, on the weekends you will find me usually in that picture up in the upper left-hand corner out in Red Rock Canyon riding my horse. I'm a big horse enthusiast, so I'm very passionate about that as well as keeping a good work-life balance. And so today we'll be talking about these top benefits of telemedicine: access to care, cost savings, convenience, demographics, and productivity. So let's get started. How does telemedicine work? Telemedicine uses technology to facilitate communications between doctors and patients for medical evaluation, diagnosis, and treatment. You communicate and consult with a board-certified physician 24/7, 365 days a year through your phone, your laptop, your desktop, your iPad, whatever is handy. And a board-certified physician will diagnose your symptoms, recommend treatment, and then send, if appropriate, send a prescription to a local pharmacy. With the different models or the different applications of telemedicine, they all have this similar type of platform where you download the application onto your phone or onto your desktop. If you have a condition that you want to get checked out, but you don't feel like sitting in an urgent care or waiting room, upload your stick into your app, upload your medical history and your ID if you have insurance, request a consultation. You're able to choose between doctors and specialists in the area. Once a physician has been requested, you'll usually get a call back within 10 to 12 minutes to start your virtual consultation. Hopefully then the physician will resolve the issue, dispense any prescriptions to the pharmacy, and make a note on your medical records so you can have continuity of care with your primary physician. And they'll usually send a follow-up email or text to make sure that your issue was resolved to your satisfaction. So the biggest benefit to telemedicine is how it improves access to care. For individuals or employees in rural areas, telemedicine allows you to connect with doctors and specialists in areas with few or limited providers. So you don't have to drive 20, 30, even 40 minutes to your local clinic. Saves time on travel and time in the waiting room. Telemedicine also improves access to care for employees and individuals with limited networks, which we're seeing a lot more of, especially in the last few years. The beautiful thing about telemedicine is there are no network restrictions in the U.S. You can go anywhere. It doesn't matter if you're in-state, out-of-state, in-network or out-of-network. Telemedicine will cover you throughout the U.S. Versus if you have an HMO plan. With HMO plans, there is no out-of-network coverage. And increasingly, we're seeing these new EPO plans, which is called Exclusive Provider Organization. And what that is it's actually a PPO plan without any out-of-network coverage. So if you have one of these plans, if you're on an individual market or individual plan, you will not have any coverage outside of the state, outside of the county. And some EPO plans don't have any coverage outside of the state. So this is where telemedicine can help bridge that gap in coverage if you are out of your area. Also, uniquely to Nevada, we have a lot of second and third shift employees. So again, telemedicine is available 24 hours a day. While most physician offices close at 5 p.m., and that's not convenient for employees who are working second or third shift. So the number 2 benefit of telemedicine is cost savings, and it can be pretty significant. Telehealth can help with these common conditions. It's not a cure-all for everything. If you are critically injured, if you have broken a leg or fractured something, telemedicine is not inappropriate. But telemedicine can certainly help with these common conditions, such as a cold, allergy, a flu, or a fever. It can help with behavioral health, such as addiction, bipolar, depression, and stress. And it can also help with dermatology, with acne, rashes, spots, eczema. It can also help with allergies. I've seen it used really successfully for blood pressure. If you have high blood pressure and your physician requires you to go in and visit them every month to get a prescription refill, and you might find that that's an unnecessary use of your time, consider using telemedicine to get your blood pressure medication refilled. Look at the cost savings compared to the average cash price for urgent care, primary care physicians, and emergency room visits. Urgent care, a vaccination averages about $155 a visit. A primary care physician averages about $165 a visit. An emergency room visit is even higher at $13.18 a visit, and this is nationwide averages. So you may have a smaller copay with your insurance, but still, as compared to telemedicine consultations, which can run from no copay to a $40 copay, depending on which platform you use, it's a significant cost savings. In addition, if you're an employer, telemedicine can lower your claims utilization. So if you're a large employer or if you have a self-funded plan, you know that your claims utilization is going to be used annually when the insurer considers rate increases. If you incorporate a telemedicine plan with your large group plan or with your self-funded plan, that's going to separate those claims away from the claims utilization and help you mitigate some of those rate increases. For employees and individuals, it'll help lower your out-of-pocket costs. So if you have an HSA plan, for example, where all benefits are subject to the deductible and you haven't set aside your deductible amount yet, telemedicine is a great way to just have an easy, low copay until you've reached your deductible. Same thing with plans that have limited number of office visits before being subject to the deductible. I know there are several plans out there who have 3 primary care visits per year before being subject to the deductible. This will help you get a few more in without having to hit that deductible. And again, it will save on your office visit and urgent room copays. The third benefit of telemedicine is its convenience. Because telemedicine offers 24/7 healthcare, you have a doctor at your fingertips versus waiting times in emergency rooms, urgent care, and doctor's office, which can range from 60 minutes to 4 hours. The average telemedicine consultation lasts around 12 minutes. You can avoid long waiting times. You can avoid leaving the house while you're sick. And if you're at work, you can do a video consultation at your lunch hour and pick up a prescription on the way home. The fourth benefit of telemedicine is the change in workplace demographics. So telemedicine adapts to our changing workplace demographics. 60% of millennials want telehealth, according to a 2015 Salesforce survey. Millennials will be half of the workplace by 2020. Why not implement a telemedicine benefit to be able to service your millennial employees and staff? Also, family demographics. So a lot of employees or individuals, you might have children who are in college out of state. If you're on an HMO plan, they're not going to be able to get coverage except for in cases of emergencies. With telemedicine on a family plan, they can get those common conditions treated at a zero or very low copay, so you have that extra peace of mind. Again, second and third shift employees having access to care 24 hours a day without needing to go to the emergency room is an extra benefit. And there's also been a surge in remote and home-based employees so that they're able to access telemedicine as well in the comfort of their home. And finally, the fifth benefit of telemedicine is increased productivity. So telemedicine can help reduce absenteeism by reducing commute time to and from doctor's appointments, reducing waiting times during those appointments, and hopefully fewer employees are delaying treatment because they can't get in to see their doctor for 3, 4, 5, or 6 weeks. With telemedicine, your consultation is instantaneous, the same day. You can get your condition treated early and hopefully get that resolved. So, where do I get it? There has been a growing telehealth option. All these different platforms are telemedicine providers. You can see someone that looks familiar to you, such as Now Clinic, which is affiliated with the Sierra Health and Life, Tele-Health, which is affiliated with Aetna, and MD Live, which is affiliated with Anthem Blue Cross Blue Shield. But it is an on-demand, growing industry. It's funny because I was doing some research for statistics that I was using in this webinar, and I learned that Doctors Without Borders actually uses telemedicine to consult with specialists all over the world. In addition, Mercy Hospital uses telemedicine extensively for their consultations. So it goes above and beyond just the normal, the applications I'm talking about today. It is a growing industry, and I hope that you'll embrace it. Here are the two ways that you can purchase telemedicine. In some cases, that telemedicine platform is built into your health plan. So shameless plug for the Las Vegas Metro Chamber Health Plan. They do have MD Live telemedicine at $0 cost. So there's no copay for the telemedicine with the chamber plan. Obviously, you would still have a copay for any prescriptions, but the service itself is free. United Healthcare, Sierra Health, and Aetna also have telehealth built into their medical plans with $0 to $20 consultations, depending on your plan and depending on the carrier. What's nice about the telemedicine that's built into the healthcare plan is that they already have your insurance information. They have your member ID. It can track in with your deductible usage, with your network, and all of that, so they can keep records, keep continuity with your records. But if you are on an individual plan or you're a startup employee or a startup company that hasn't yet decided to offer employee benefits and want an affordable employee benefit that people are going to find valuable, you might want to purchase telemedicine as a standalone platform. Some of the vendors that sell on a standalone platform are Tele-Doc and HealthyAsYou. The average cost per employee or per individual runs around $7 to $12 per month, and then you can add your family for about $15, for total $15 per month for family coverage. Once you purchase that standalone platform subscription, there are 0 consultation fees. Again, you'll still have to pay for the prescription, but the consultations are 0 after you have that subscription. So there's 2 ways that you can purchase telemedicine, again, either included with your health plan or on a standalone platform. So in summary, telemedicine is convenient, it saves money, and is a great addition to your individual or employee benefit plan. Thank you so much for taking time out of your day to spend some time with me, and if you have any questions, please use the chat box, or you can email me at sophia@optimus.com for a copy of the slideshow or for any additional questions, or if you just like some more information for yourself or your business. Thank you again. It's been a pleasure talking to you, and enjoy your Friday.
Thank you so much, Sophia. Does anybody have any questions? Thank you all so much for your time today, and don't forget to tune in next week where we discuss the do's and don'ts of advertising for your business. Thank you.